On behalf of the Area Agency on Aging of Pasco Pinellas, I welcome you to Aging on the Suncoast. In July, U.S. Attorney General Eric Holder recognized Miami as the ground zero of healthcare fraud. Florida has earned the unfortunate distinction as the leader in the number of Medicare and Medicaid scams and the resulting financial impact. Fortunately, there are also a number of efforts working to prevent and fight this healthcare fraud. On today's program, we have three guests to discuss Medicare and Medicaid fraud, how to prevent it, and how to report it. Makiba Huntington-Simons is a member of the Area Agency on Aging staff and program manager of SMP in Florida. Carol Connery is a law enforcement lieutenant with the Medicaid Fraud Control Unit. And Ian Ives is a special agent with the U.S. Department of Health and Human Services, Office of the Inspector General. Welcome to Aging on the Suncoast.
Thank you.
Thank you for joining us today. Now, Makiba, you are working with the SMP program. Tell us what that is and what its mission is.
Well, thank you, Marilyn. The Senior Medicare Patrol, or the SMP program, our mission is to train volunteers and to educate beneficiaries on how to avoid Medicare fraud, how to prevent Medicare fraud, and protect themselves against Medicare fraud.
And how is that program funded?
The program is funded through the U.S. Administration on Aging, and it's administered through the Area Agency on Aging.
And we have discussed already that it covers the state of Florida.
Yes, it does.
You're working out of our area agency to do that.
Yes.
Share with us what some of the accomplishments of the SMP program have been, both locally and nationally.
Well, we recently garnered a lot of attention during the healthcare summit in Miami. SMP was at the forefront as far as our grassroots efforts in the state. My understanding is that we have recovered over $1 million in the state of Florida due to SMP and our volunteers and our volunteer networks and our partners in Florida.
And nationally, I understand that in the course of the SMP program that there have been over $100 million recovered as a result of this education and reporting through the SMP program.
Yes.
So congratulations on your success. Obviously, there's continued need for the program. And you, in much of your work, you partner with other programs, such as Carol Connery and the Medicaid Fraud Control Unit that is attacking Medicaid fraud in the state of Florida. Share with us, I know SMP is aimed at Medicare beneficiaries and their reporting and education. Carol, tell us what Medicaid is and how that's different than Medicare.
Medicaid was established in 1965 under the Social Security Act, and it's under Title 19. And it's a federal and state health care program that for every dollar spent in the state of Florida right now, the federal government will contribute 55% and the state contributes 45% of it. And it is a program that is for the indigent, which is many women and children that are in the program. Presently, there's about 2.97 million Floridians that are Medicaid recipients, and we have a budget of about $20 million for this fiscal year.
And that includes not just the individual who's going to the doctor, but also persons who are in nursing homes, hospitals, all levels of care, just like the Medicare program.
Absolutely,
is covering a variety of levels of care. So you have not only a variety of beneficiaries or recipients, but also providers that are involved in these systems.
Yeah, there's a very wide or broad section of providers. In the state of Florida, we have approximately 100,000 active providers that are registered as Medicaid providers.
And I guess we need to make the point that most Medicare providers and Medicaid providers and most recipients and beneficiaries act in a very honest way. It is hopefully the rarity where there is a problem. And we'll discuss later some of those problems that do occur. Some individuals are dual eligible or eligible for both Medicare and Medicaid.
Yes, that's correct. Depending again on their income and their assets, their people can be eligible for both programs, and that's done. The eligibility is usually done through Social Security Administration and through the Department of Children and Families in the state of Florida.
And tell us what the role is of the Medicaid Fraud Control Unit.
We are a statewide law enforcement agency that has approximately 200 folks working for us. About half, a little more than half, are investigators, mainly sworn. We do have some civilian investigators. We have nurses on staff, auditors on staff, analysts, and of course attorneys that we can work with. From day one of a case, it's wonderful to have an attorney that you can work with from beginning to end to get your case done, either civilly or criminally. We can proceed both ways, so it's nice to have that.
Okay. So the distinction between that and the SMP program, in addition to operating with strictly Medicaid, strictly Medicare, and both of you can work with those who are eligible for both programs, but your program is not a law enforcement program.
No, we're not. No, we're not. We are a grassroots
and
effort.
a very volunteer-based program.
Yes, it is. Yes, it is. We have a pretty large volunteer network here in Florida.
Okay.
Yes.
That you're educating retired volunteers to be spokespersons and advocates to prevent healthcare fraud.
That's right.
Okay. And one of the entities that both of you are working with is the HEAT Task Force. And Ian, I appreciate your being here to talk with us about what that is.
Well, the HEAT Task Force, our main mission is to prevent and deter and aggressively pursue healthcare fraud by using real-time data. And we're made up of a group of OIG professionals to include agents, attorneys, and analysts, which most of our cases could run anywhere from 6 months to well, actually the longer cases could go anywhere from 2 years and beyond. Our HEAT cases, we try to from start to finish, we want to try to wrap it up within 6 months and get them indicted, charged, and go from there.
So you're somewhat trying to fast track.
Exactly.
And have a comprehensive approach to both the investigation and the prosecution.
Yes.
Of persons who are perpetrating fraud.
Yes.
In these areas. And I understand that nationally there are 7 HEAT strike forces, and again Florida has that dubious distinction of having one that is located in Miami and then another one in Tampa, again because of the prevalence of fraud, I assume, in our state.
Yes, correct.
And what geographic area do you cover out of the Tampa office?
From the Tampa office, we covered the Middle District of Florida, which Florida is divided into 3 federal districts. You have the Southern District, which is the Miami Task Force, the Middle District, which is us here in Tampa, and the Northern District we do not cover, but most of our cases go from anywhere from Naples all the way up to Ocala. And but most of our cases we try to focus around the Tampa Bay area, because around the Tampa Bay area, that's where the biggest fraud is at right now. So,
it is?
Yes.
Okay. Give us an idea of the extent and the impact of Medicaid and Medicare fraud that you were seeing.
Well, with Medicare, we're seeing it in all 4 programs. We have Medicare Part A, which is the hospitals, and we have nursing homes, where, for example, there could be a group of beneficiaries in an assisted living facility who's supposed to receive one-on-one physical therapy.
Right.
But instead, it's done in more of a group setting. So, and the providers know this, and a lot of the beneficiaries who stay in the assisted living facilities, they don't know that it's supposed to be done in a one. Right.
Delivered.
So even if they were to be conscious of their explanation of benefits, they cannot tell because they don't. It's very, very difficult. I mean, we have so many rules that, and these providers know this, so they take advantage of those folks in the assisted living facilities. As far as Part B, our outpatient services, we see a lot of services not rendered, which a physician in a doctor's office could look at maybe 60 patients in a day, and they'll say that for each patient they did all these procedures from high-level office visits to different shots, and it's just impossible. That's why with the real-time data that we get from the strike forces or the HEAT initiative, we could see right away that there's no way, based on this data, that this provider could provide these services. And then we look at certain examples or time pockets, and we go back maybe 3 years and see that, okay, he's been doing it for a while now, it's time to aggressively go after these providers.
Okay. So you have access to, when you say real-time data, recent records of billing for the providers as well as going historically back, so you can see if there have been patterns that do not make sense. You can do comparisons with other providers of similar services.
Yes, that's how we see the spikes, basically. We see one provider and we see the peers around him in the geographical area, and we see that, okay, most of the billing is 90% from this provider, and the rest of the crowd is going maybe 10%. So there's something wrong with this picture. So we look for the obvious, and we try to, spike them and go after them. So.
And similar types of abuse within the Medicaid program?
Yes,
Carol?
absolutely. We pretty much mirror what Ian is saying so far as looking at patterns and trends. And we've been lucky enough to be able to do some data mining that's been authorized through the Centers for Medicare and Medicaid Services here in Florida. So we are kind of on the forefront for all of the Medicaid units throughout the U.S. to be able to do this and to show patterns and trends and aberrant billing. So we're doing exactly what Ian is suggesting, yes.
And you've mentioned parts A and B, the hospital part, the provider part, and of course Medicare Part C is the Medicare Advantage plans, the managed care programs. Are there some trends that are happening?
The Advantage plans basically piggybacks off to other plans because it's a supplement. So I mean, it's the same trends, but it's just adding more to it. What we're seeing now is Medicare Part D, which started in a couple years back. Now we're seeing a large trend in that where a lot of the drugs that's being filled at the pharmacies. A lot of expensive drugs are not actually being picked up by the beneficiaries because if they have 4 scripts and they want the painkillers, which is the most popular drug, we have a big problem with that in Florida. They don't care about some of the other drugs that they might need, some of the sleeping aids or some of the blood thinners. They just want the pain to go away.
Right.
So most of the beneficiaries are not in it with some of these pharmacies, but they overlook it. But it's kind of hard to find some of these folks because we have to look at so much data in Part D. And Part D, I mean, one pharmacy could have so many plans that they could go through. It's not like if you go to one Walgreens, you got one plan. You have multiple plans that's going through it. So it's. I mean, even with the data mining, we're working it, but we're having a challenging time trying to, narrow down some of the fraud in Part D.
And Makiba, are you seeing some other trends with Medicare and Medicaid fraud?
We are seeing some trends with the Medicare Advantage plans. As far as their marketing is concerned, they're bound by strict guidelines as far as their marketing. They cannot invite people to dinners and what have you and have them sign up for their plans. So that's what we're seeing in our office when we get the calls in our office on our hotline. Yes.
And I've also read recently, I guess over the last several years, that there have been some focus upon durable medical equipment companies and home health agencies. What are happening in some of those areas?
Well, we're getting lots of calls into the office as far as people receive or being billed for medical equipment that they have not received, or they'll have the wheelchair in their houses and they don't need it and they don't know how to return it because they're not providing return slips to the beneficiaries. And